friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like you said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in ElDorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you.
Welcome back. I'm Angela Yarborough and Dr. Jerry Yarborough. We are Physical Therapy and Balance Centers. Therapy Thursdays today with Louisiana Living, and today we're going to talk about goals. It's the New Year's still, and people are still making New Year's resolutions. I really just don't like that word. I like the term goals because it almost gives me permission that if I meet that goal, I can continue and move up and upgrade it. Instead of a New Year's resolution, once you hit it or you've got all year to do it, it's done. But we're going to talk to Dr. Jerry about goals specific to our health.
Right, thanks. And I completely agree with what you're saying there. And I like to use an acronym SMART to help set goals. Now, I didn't come up with this. I don't know who to give credit to, but it's been around for a while. And it's just an acronym to help you set goals properly. So remember, the acronym is SMART, S-M-A-R-T. S stands for specific. Your goal should be specific. And we're talking about fitness. So a specific goal example would be, I want to lose 20 pounds versus a generic goal of, I want to lose weight. So you got to be specific. It has to be measurable. So again, 20 pounds is measurable. You can measure it week by week. And when you're weighing yourself, I recommend that you do that because daily we have ups and downs, even depending on the time of day. So when you're weighing yourself, I really recommend that you use one set of scales. So if you have scales at home, that's the best. Just go by yours. Doctor's scales always have more weight onto them than yours at home do. Or that's my case anyway. I like my scales at home. So use the same scales at the same time of day. Then for A, it has to be achievable. So to say, I'm going to lose 150 pounds by next week, is that really achievable? No, not unless they cut off some legs or something, right? So you're not going to do that. So it has to be achievable. So 20 pounds over 6 months is very achievable for most people. All right, and then the R, it has to be realistic. Again, that kind of goes along with the achievable, but being more realistic. Again, you're not going to lose 150 pounds overnight or within 1 week. That's just not realistic. So, and then it has to be time bound. So the T stands for time bound. So you're going to lose 20 pounds. That's achievable. It's realistic, and then you're going to lose that within 6 months. So you got that time frame. Otherwise, you just know, kind of like your New Year's resolutions.
It
like,
just keeps going
okay,
and going.
when is this going to happen?
Right.
So it just gives you times to shoot for. So again, I want to encourage you to set those goals. A lot of people are against New Year's resolutions, and I can understand that, but I'm very goal-oriented. If you have something you want to achieve, I strongly believe you have to set goals. And you can set short-term and long-term goals. That's what we do in physical therapy with all of our patients in our plan of cares, okay? So come back in the next segment, and I'm gonna talk more about just starting a good routine to help you maintain fitness and your ability to move. So we'll see you in the next segment. Hey guys, welcome back. I'm Dr. Jerry Yarborough, physical therapist, and we are in the middle of Physical Therapy Thursdays here on Louisiana Living. Now we talked about goal setting, and I wanted to share with you guys a very good comprehensive stretching program. It's very important that we maintain our flexibility in order for all of our joints to move properly and to help eliminate pain. So today we got Nicholas. This is my son, and he's going to demonstrate with me some stretching exercises. We're going to start at the top and work our way down, okay? So first we're going to start with your neck. So to stretch your neck, we got different movements of the neck. First is going to be rotation. So rotate your head. You're going to go as far as you can, and if you don't feel a stretch, use your hand and give a little, very gentle push to get a little additional stretch. Now with all of our stretches, you're going to do about 3 times 30 seconds. That's what research shows the best to be, and you're going to do that both directions, okay? So like that, and then we also have side bending of our neck. So you're going to bring your ear toward your shoulder. Again, if you don't feel a stretch with that, use the weight of your arm on your head to get a little additional stretch. And you're going to do that both directions. Okay? And then we also have flexion. So you're going to bring your chin to your chest. If you don't feel a stretch with that, use the weight of your hand again to give yourself a little additional stretch. You never want to stretch into pain. If you're stretching into pain, you're causing trauma, which will cause inflammation and cause pain. Do not stretch into pain, okay? It should just be a gentle stretch. All right, then we also have extension. So you're going to raise your head up. There you go, good. Okay, so those are good for the neck. Now we'll move down to the shoulder. A good shoulder stretch is a posterior capsule stretch like that. Again, all stretches, 30 seconds, about 3 times. A couple of other good stretches for the shoulder and upper trunk is shoulder flexion like this. You're going to remain in good posture and bring your arms back as far as you can. All right, and then you can even come down into a Y, and you can kind of bounce it a little bit like that. Again, 30 seconds, okay? From here, bring your arms behind your back and reach up as high as you can. You should be able to reach up to about the middle of your scapula, your upper back, okay? And then we'll move from there. We're going to do a trunk rotation. So you can use a table or chair that you're on to help give yourself a little additional stretch, like Nicholas is doing here. Okay, so from here we're going to move on down to our hips and legs. So Nicholas is going to lay on his stomach. And we're going to start on his elbows, keeping your pelvis nice and flat. And then as you can tolerate this well, push up onto your hands. And you're going to try to hold this for about a minute, okay? and try to do that 10 times. All right, go ahead and roll back onto your back, Nick. Next, we're gonna stretch the piriformis. That is one of the most common muscles to get tight that will cause sciatica, which is pain going down your leg. So cross your foot over your opposite knee and pull that knee up toward your opposite shoulder. You're gonna again hold that 30 seconds and do it 3 times, and then you're gonna push down, push your knee down away from you, same thing. All right, and from here, we're gonna finish out the leg with our calves and our hamstrings. You can use a stretching strap like this. You can use a towel, a belt, or whatever. Put it at the forefoot there. Make sure your foot is good and flexed, so you're stretching the ankle, and then pull up. You're gonna get additional stretch in the calf, in the hamstrings, and in your lower back. Okay? Again, 3 times, 30 seconds for all stretches. And that's a general head to toe stretching program. And I would encourage you to do that daily. That didn't take very long. You can do that within just 10 minutes every day. Flexibility is as important as strengthening. Now next week, we're gonna continue this segment and we're gonna be talking about some strengthening exercises. So come back and see us next Thursday at 4:30 on Louisiana Living. Thanks.